Let's take our first look inside the DisImpactor box. So this is the pre-packaged kit that you would be receiving. And in the kit, you'll notice the first and most important thing, which is the instructions for use. You have to be familiar with the instructions for use, obviously, before doing the procedure. So you'll want to read these, or you can also visit the website at www.nuvomed.com, and they're obviously available there as well. Inside the kit, you'll also see that there are 3 DisImpactor devices. There's 2 in the first package and 1 in the second, and this has the extension tubing that we talked about. You'll see that there's a supply of the lubricant. There's 2 60cc syringes, and this is what we'll be using to instill the enema fluid. There's a chucks pad to place underneath the patient during the procedure to capture spillage. And then lastly, there's a biohazard waste bag, and that's where the used devices will go as you finish with them. So essentially, what we would do at this point is begin with patient positioning. So if you're right-handed, what will be easiest for you is to have the patient in a left lateral decubitus position, meaning that the patient's laying on their left side, and then preferably with their right thigh drawn a bit up toward their abdomen. That will give you the best access for manipulating the device if the patient is here and the device is coming in this way, utilizing your right hand. We'll also want to make sure that there's a chucks pad under the patient to catch any spillage. So at this point, we have the patient's informed consent. We've checked the inclusion and exclusion criteria, and once again, you would, with a gloved and lubricated finger, perform a quick digital rectal exam. That will confirm the impaction, and it'll also lubricate the anal area and begin relaxing the external anal sphincter. The next step is to take the device, use the provided lubricant. You're going to generously lubricate the entire head of the device, and we're going to place it onto the patient's anus and ask the patient to ever so slightly bear down. It's that slight bearing down that allows them to relax the external anal sphincter and allow the admittance of the device. So as they're just slightly bearing down, we're going to gently insert the device and get the entire head of the device past that second bullet into the rectal vault, past the anus. At that point, patient should have tolerated that fairly well, and we can now begin the gentle manipulation with a clockwise, counterclockwise movement and begin to encounter the fecal load. What will happen is you'll stay within the long axis of the fecal load, and you'll, through the tactile feedback, feel the device entering it. Our goal is to get all of these fins to engage within the fecal mass. So rarely do we need the entire length of the device. That's provided because of different patient body habituses. But you'll certainly want to be able to feel that the device has completely engaged within the fecal mass. Once that occurs, we're now going to ask the patient to bear down as if they're having a bowel movement, and we will withdraw the entire device. Once the device is out, you'll need to inspect it, assure that it's intact, and then discard it right away in the biohazard bag. These are single-use, non-cleansable or sterilizable devices. What you'll need to assess at that point is where we're at in the procedure. Rarely will you have relieved the entire impaction with a single pass. That's really not what the device is intended to do. Essentially, the device will likely fragment the stool, and what you'll see is that pieces of stool will come out, or there'll be stool affixed to the device, but it's very uncommon to get that candy apple, so to speak, where the entire impaction is on the first device. So plan on understanding it from that point of view, because our goal is to really fragment the fecal load and get to the step where we're administering enema fluid. So what we would do is we now take a second clean DisImpactor and do the same procedure. Again, we're going to ask the patient to just slightly bear down. We're going to insert a well-lubricated device, stay within the fecal load in the long axis, and do the same procedure where now they bear down and the device is withdrawn. We'd again inspect it and discard it and assess the clinical variables. Did that relieve the impaction? Always a chance that it may have, but quite likely the impaction is still there, and that's what gets us to our third and final device. It's this device through which we'll instill the enema fluid. So as we prepare our third device, you can go ahead and attach the lure coupler to the device, and you'll want to make sure that your syringes of enema fluid are ready. So typically you'll have emptied your enema fluid of choice into the basin, and it's usually about 120 cc's, and so it's 2 of the 60 cc syringes that you'll need. You'll begin the procedure again, just like with the first two passes, well-lubricated device into the rectal vault, but this time you'll pause because you'll want to couple the syringe directly to the device. So with the syringe now coupled, we can gently infuse our enema fluid, and you'll see that with gently pressing the device, the enema fluid is able to easily exit. So this will be obviously going into the fecal load, so you'll want to assure that the patient is comfortable during the procedure and tolerating it well with a nice, slow, gentle infusion. Once the fluid is in, you'll want to clip the lock that comes on the tubing, and that just prevents any backflow through the tubing. And you'll again withdraw the device and discard it after you've inspected it. This time, now the patient has the enema fluid inside, and we'll want to give them the standard 5 minutes or so to allow the enema fluid to work, at which point someone will assist them to a bedside commode or pan and look to see if they've passed the entire fecal load. A great number of patients will, at that point, have a massive bowel movement with relief of symptoms, and that confirms passage of the fecal load. If this procedure has not fully relieved it at this point, then some patients may require an additional enema. And again, that's your choice as to which fluid to use, but another disimpactor device would likely not be required. The enema could be given in a traditional means. If following that it's still not effective, you can use another disimpactor device to aid in further removal. The combination of these techniques, particularly that first round of enema fluid which is required, will lead to the relief of most patients' fecal impactions. So let's briefly summarize where we're at and conclude this video by saying that the DisImpactor is available as a new clinical tool to assist your patients with fecal impaction. Very important to make sure that you're familiar with the instructions for use before proceeding with using the device. It's important to follow the inclusion and exclusion criteria after confirming that the patient does have a fecal impaction on your digital exam. And then realize that when you're using the device, it's a combination of fragmenting the stool, creating a cavity within it, removing some of the stool, and then getting that enema in there deeply so that the enema has a chance to really work and dissolve the impaction. If you follow the instructions and protocols, it will help optimize your success in using the DisImpactor as a new clinical tool. Should you have any questions, we're always available to answer them. All of our contact information is on the website at www.nuvomed.com. That's nuvomed.com. I'd like to thank you again for your time and patience in going through this video, and we wish you success in treating your next patient who has a fecal impaction.